Here is what you need to know about that high deductible supplement plan that you may have been hearing about. High deductible Plan G is getting more and more buzz in the Medicare world, and for good reason. Now there is a high deductible Plan F as well, but this video is specifically around the Plan G. It is a Medicare supplement plan that works similarly to regular Plan G with a major exception. High Deductible Plan G has, well, a high deductible, meaning before your plan will start helping you pay for things, you are going to need to spend a little bit out of pocket. Now, before you stop this video and run to talk to your agent about this plan, I'm going to go through the strengths and weaknesses of this specific plan. And should we start with the good news or the bad news first? Let's start with the good news first. The good news with the High Deductible Plan G is that the monthly premiums are significantly lower than the regular Plan G or Plan N options. The average regular Plan G nationwide for a 65-year-old is around $130 per person per month. Plan N is around $100 per month. I say this in all of our videos, but if this is your first video with us, these numbers vary dramatically depending on where you live. In some places, Plan G and Plan N start at around $300 per month. The High Deductible Plan G, that's coming in with an average around $60 per month. Using the averages, you're saving around $800 per year in premiums versus regular G, and around $500 per year versus a Plan N. Compound that over 20 years, and it can be a significant number. Another strength of the High Deductible Plan G is the fact that you still have Original Medicare, where you can still visit any provider or facility as long as they have not completely opted out of Medicare. This is about 99% of all non-pediatric providers nationwide. In the event that you do visit a provider that does not participate with Medicare but has not fully opted out of Medicare, you could see excess charges that Plan N does not cover, but this High Deductible Plan G would cover after you've met that deductible. If you have a health savings account or HSA, you can use those HSA dollars to pay for that deductible. You cannot use them to pay the High Deductible Plan G premiums, but you can use the HSA dollars for the deductible. Okay, now let's move to some of the weaknesses. The glaring weakness is that deductible. And look, if nothing goes wrong, you don't have any medical issues, this is great. But if you do need to use the healthcare system, in 2024, you are paying $2,800 before your supplement plan starts to help. Now, there is some confusion as to how this all works, so let's go through it with an example. Let's say that you have $50,000 in total Medicare-approved medical bills. This means Part B for those who want to get specific. This may not be all in one bill, it may be spaced out over the year, but for kicks and giggles in this video, we're going to pretend like it's all one bill because that will be more simple. Original Medicare does not start to cover Part B expenses until you meet your Part B deductible. In 2024, the Part B deductible is $240. So you pay $240 first. You now have $49,760 remaining on this bill. Well, Original Medicare takes 80%. You and your High Deductible Plan G will handle the other 20%. 80% of $49,760 is $39,808, leaving you and your plan responsible for the remaining $9,952. And how does that get split between you and your plan? Well, you have that $2,800 high deductible. Fortunately, the $240 that you paid as the Part B deductible earlier counts to that number, so you have $2,560 left on your deductible. Of the $9,952, you need to first write a check. Wait, are we still writing checks today? You need to pay the $2,560 however you choose to pay that first before your plan will step in. Once you pay that, the High Deductible Plan G takes care of the remaining $7,392, plus if you have any more approved Part B expenses that year from providers who have not opted out of Medicare, your Original Medicare and your High Deductible Plan G are taking care of those 100% until the next year on January 1st when your high deductible starts over. That's one example. A separate weird wrinkle here is that in that $240 Part B deductible counting towards your $2,800 high deductible, I was specific in saying Part B expenses earlier for a reason. If you are admitted into a hospital, those are now Part A expenses. Part A is your hospital coverage. Part B is your medical coverage. And if you meet your high deductible, that $2,800 with Part A expenses, the $240 Part B deductible does not go towards that $2,800. So again, you meet the $2,800 with Part A expenses, then later you have Part B expenses. You need to pay the $240 out of pocket, bringing the total out-of-pocket costs from your deductibles for you to $3,040 instead of just the $2,800. Okay, I have two more weaknesses for High Deductible Plan G, and then I'll share our experience with those who have chosen High Deductible Plan G. So another weakness is that they are not available everywhere. Insurance companies that offer Medicare supplement plans must offer the 10 standardized plans, but they do not have to offer the high deductible version. So in our state, as an example, most of the insurance companies do not even offer a high deductible Plan G. Only one of the major carriers does, and it doesn't really have much traction here. So this may not be available where you live. The last weakness isn't specific to this plan, but to all supplement plans. High Deductible Plan G does not cover prescription medications, dental, vision, or hearing aids. So if you want coverage for those, you would need to purchase separate plans that each have their own premiums, deductibles, copays, and coinsurance out of your pocket dollars. Okay, let's look at a couple real-world numbers that will help illustrate whether or not this plan will make sense for you. Remember, using the averages, regular Plan G would cost about $800 more per year in premiums, and Plan N was about $500 more per year in premiums. But if you have a year where you hit your high deductible, you're losing almost $1,800 compared to regular Plan G because of that high deductible, and then you would be losing about $2,000 versus Plan N. You just wiped out over 2 years worth of premium savings versus a regular Plan G and 4 years of your premium savings versus a Plan N in one bad year with the high deductible Plan G. And that's assuming a year where you hit your full deductible. We used a $50,000 expense. It only takes a bill of $13,040 to hit your full high deductible Plan G deductible. $13,000, even with heavily discounted Medicare approved rates, really isn't a lot to push you into fully hitting that deductible. The break-even point is $4,000 in total bills, meaning if you have $4,000 in approved Medicare Part B costs, using our averages, you will break even with a regular Plan G versus a high deductible Plan G. Any bills over $4,000 and regular Plan G is saving you money. For Plan N, that number is just $2,500 in total bills to break even every year. Anything over $2,500, and you are saving money with Plan N in that year. If you have multiple bad years in a row, or even 2 to 4 years, costs can get tough. Now, our experience with the clients who choose high deductible Plan G has been that this plan either works great for people because they don't have health issues, not just when they start Medicare, but moving into their older years, and they have a sizable HSA balance. High Deductible Plan G is a strong setup for those who fit this description. On the other hand, and this happens more than we wish it did, people go into this plan bright-eyed and bushy-tailed, but as soon as things start to go wrong, and it doesn't take too much, as I showed with those numbers, that high deductible becomes really frustrating and can quickly exceed the savings that you were enjoying compared to regular Plan G or Plan N, especially those who either do not have an HSA or they do, but it doesn't have much money in it. So look, I'm not trying to discourage you from a high deductible Plan G. This is just our experience that many jump into this expecting the best, but bills happen and then they want to switch to the regular G or the Plan N, but doing so can be tricky depending on where you live. Very similar hoops to jump through as switching from an Advantage plan to a supplement plan. If you're hearing about this high deductible supplement plan out there, now you know more than you probably wanted to know, and I think you're going to want to check out this video right here if you haven't already, because we looked at the costs of a regular Plan G, a high deductible Plan G, and an Advantage plan over 20 years to try to get an idea around how much Medicare will cost you throughout retirement rather than just 1 year. I will see you over there.